The Newsday continues here on One News Now. I'm Riza Diaz. The OCTA Research Group urges the government to implement a stricter general community quarantine in Metro Manila to curb the spread of COVID-19. Speaking to One News, the chief's OCTA Research member Ranjit Rai said that the NCR should be tougher in enforcing health protocols and expand testing and contact tracing. Professor Guido David also suggested expanding the Holy Week break to 2 weeks to deal with the surge.
Let's reduce mobility now significantly. Let's be strict about our protocols and expand testing and tracing, because that's what's going to help us deal with this surge. And hope that our own. I'm very confident in the Filipino, in our countrymen, that they will be more disciplined with the practice of with exercising the minimum health standards.
Propose gawin natin 2 weeks yung Holy Week natin, and then we all stay at home and pray.
With the uniformed curfew to be imposed starting Monday in Metro Manila, MMDA Chairman Benhur Abalos is urging LGUs to have uniform penalties for curfew violators. In an interview with 1PH at Totoo Lang, Abalos also clarified that essential workers are exempted from the curfew as long as they have their IDs. They will also monitor the number of cases to determine if an extension of the curfew is necessary.
Depende po sa answer kung ito yung mag-search pa rin, pa rin, o ito yung magpaplatuno. Actually, what is important, we're always, ang mga mayors po ay tracking sa mga experts. At pwede part of sa experts at yung isang araw po, bago kami mag-announce, kausap po lang yung mga OCTA experts, no? Dr. Ranjit and the others po. Malaking tulong po sila Dr. Guido, no? Malaking tulong po sa mga mayors.
Some vaccinated healthcare workers still end up testing positive for COVID-19. That's according to Dr. Lulu Bravo of the Philippine Foundation for Vaccination. In an interview with Sa Totoo Lang, she said the reason for this is that healthcare workers have become lax in observing proper health protocols after being vaccinated. She added that this relaxation may lead to the second wave of the pandemic. Bravo advises the public to strictly follow minimum health standards and get inoculated as soon as possible.
Hindi natin dapat ipagsawalang bahala yung ating mga minimum public health standards sa PGH. At maraming nagkaroon ng positive doon. At ang nakita nila, yung mga nag-positive, nagkaroon ng chance na kumain ng magkakasama sa isang mesa. Diba? Parang nakalimutan nila yata kasi nagpabakuna yata. Ayan, nagkakaroon sila ng relaxation. Ayan, may second wave. Kasi hindi natin napapansin na nawawala na yung ating pag-iingat. Magsakripisyo muna tayo. Darating din ang araw na makakamit natin yung ating pinakaminiting pagkaalis ng pandemic. Pero sa ngayon, huwag muna po. Marami pa po tayong kailangan gawin. Bakunahan. Huwag muna tayong kumain ng sabay-sabay. Huwag muna tayong magsama-sama ulit. Talaga pong strictly. Mask, hugas ng kamay, distancing. Totoo po yun.
A year into the pandemic, experts and local executives attribute the transmission of COVID-19 to public transportation. But are drivers and commuters to blame? Let's find out from mobile journalist Pamela Velasquez, giving you a front seat to the story.
Early morning at the transport terminal in Marikina. This is commuting at the time of COVID. Commuting has been part of our daily life, but now that the public transportation is becoming more prone to COVID-19 transmission, even the slightest inobservance of the health protocol poses a greater risk of contracting the virus. The health protocols for commuting are clear: physical distancing, sanitize always, and contact tracing. But here, the queue bunches up. Contact tracing and temperature checks are often forgotten.
Yung sa amin, nasira yung temperature namin.
People don't bother wearing their mask properly, while many drivers do not bother to sanitize between trips. 1 year into the pandemic, it is clear that the realities are different on the ground. Public transportation has emerged as one of the major drivers of COVID infection, at least according to Marikina Mayor Marcy Teodoro. In the span of a week, Teodoro says that Marikina's new cases went up from 277 to 409.
Ito yung lumalabas sa contact tracing namin. Pag inaalam namin kung sila huling nagpunta, kanilang huling contact do sa maraming tao.
For Elsa, who commutes every day, this is a very real concern.
Yung barrier, yung plastic, hindi siya consistent. Supposed to be, ang spacing, dapat malaki ang spacing.
But signals from the government can be confusing. The Labor Department recently pushed for an increase in the capacity of public transport so that more people can go to work.
But of course, safety measures should be also put in place as well.
Teodoro, however, says increasing capacity is not the solution. What people need are more public utility vehicles, not more people crammed into jeeps and buses. In the meantime, people who commute to work will have to fend for themselves. Mayor Teodoro revealed that according to their projection, more cases will be reported in the coming days. That is why he's appealing to the public to remain vigilant and follow health protocols. I'm Pamela Vasquez, and we are One News.
Disposable face masks have been key in protecting us from getting infected with COVID-19. But as these masks protect us, our waters are suffering from more pollution. Romy Lopez with the report.
Either entangled in corals or under the reef, face masks have been littering the seabed along Caban Cove in Tingloy, Batangas. These underwater videos captured by NLO divers including Oliver show the new normal underwater.
Nakaka-average kami, anong tawag nun, mga 2-3 masks. Lalo yung mga cove areas, yan ang marami.
For divers, it's heartbreaking that today's primary form of protection is hurting marine life.
Yung tapon ng mga mask dyan, okay, pag tinatapon nyo naman yung mask, check nyo naman para ayos naman yung pagka-dispose ng mask ninyo.
Mga marine life, for example, pawikan, they might mistake it as food. If they eat it, they ingest it.
The LGU of Mabini said that this is an isolated case as they properly manage medical waste such as PPEs and masks. They also constantly conduct a cleanup drive.
Hindi rin namin masasabi in particular kung saan talaga ang source nitong mga basurang ito. Wala pang pandemya ay nagkakaroon na din ng mga konting basura itong particularly itong mga ganitong klaseng cove.
Fearing that this might be happening across the country, divers advocate the use of reusable masks.
Studies show na effective naman si reusable or mga washable mask. Why not use your washable mask para just to lessen ba?
The DENR urges LGUs to properly dispose PPEs and masks.
Dapat na mga local government unit, meron silang lugar na pwedeng i-treat yan, and then before they finally to be disposed sa landfill. So i-strengthen natin yan.
The agency added that they are also monitoring inlets or estero where informal settlers may improperly dispose waste. For News 5, Romy Lopez. We are One News.
Palawan has started its plebiscite to vote on the division of the province into 3. To give us more details on the ground, we have Dale De Vera reporting to us live from Rojas, Palawan. Dale, how's the voting going there so far?
Riza, here in Andres Soriano Memorial Elementary School, the voting started late as ballot boxes were only delivered few minutes before the plebiscite was set to start. Teachers acting as members of the plebiscite committee were told to be at the polling precincts at least an hour earlier to prepare for the voting. But the ballot boxes, along with other election paraphernalia, arrived in the school only 15 minutes before 7 a.m. This likely delayed the opening of precincts. The ballot boxes were supposed to be delivered yesterday, but when plebiscite committee members went to get it, they were told that it will be brought to the school instead. Right now, voting have started and people have been following health protocols which are being strictly implemented. Social distancing are followed with only 5 voters at a time allowed inside the polling precinct. Alcohol and disinfection are also in place. If a voter has a temperature of 37.5 degrees Celsius and higher, he will be allowed to vote but in an isolated polling precinct. Risa, at 3 this afternoon, poll precincts will be closed to give way to the canvassing of votes, which will be done manually. Results will be brought to the Municipal Board of Canvassers before it will be sent to the Provincial Board of Canvassers, who will declare the official result. Riza, results are expected to be out as early as March 16. Riza?
Thank you for that report. That was Dale De Vera reporting from Palawan. What's the best COVID-19 vaccine? Emory University's Carlos Del Rio answers that question on Bloomberg Quick Take. Let's listen in.
The best vaccine is the one you can get into your arm. All the vaccines that are currently available are actually very effective in preventing you from getting sick, preventing you from dying, preventing you from getting hospitalized with COVID. So I would say, take the vaccine being offered to you. The most important thing is to be vaccinated. Some vaccines may be better against some variants than others. Some vaccines may be better in older people than others. I think we still need a lot of research to understand that data. Some vaccines may have longer protection time than others. The research has not ended. Right now, what we have is emergency use authorization. That means there's a public health emergency and the vaccines are being authorized to use because of the public health emergency. But they're not yet fully authorized, and that is pending some more studies. And, research is still happening. We're in the middle of this crisis. We're trying to get over the crisis. Then we'll figure out what happens long term. But in the meantime, even one vaccine is better than no vaccine. And get vaccinated because, what will happen later? It reminds me about the early years of HIV. We use antiretrovirals and we said, cure the antiretrovirals you have. And we're starting an antiretroviral therapy and we saved thousands of lives by starting people in what I think were not the best antiretroviral drugs. Even back then, even in the US, we're using drugs. And nowadays, I get chills to think that we were actually giving that to people, but it saved lives. Now, if somebody back in 1996 would have said, no, I'm going to wait until there are better drugs, they would have been dead. There's a lot of very smart minds working on COVID vaccines. I think we're going to get much better vaccines. I think we're going to be talking in 3 to 5 years about very different vaccines.
In quarantine. 12 months of battling the coronavirus. 12 months of living in a new normal. This March 14, One News brings together the people who helped shape the way we live in the year of pandemic. How have we managed? What we may have missed? Where are we headed? Some of the country's leading voices in the scientific and business communities face the nation as the Philippines balances public health and economy. Kumusta na ba tayo? A town hall in the time of pandemic. Moderated by Robbie Alampay and Cheryl Cosim. Join us live March 14, Sunday. We are One News.
And those are the top stories of the hour. Join us later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.